The 22 designated cancers include a few that are a little more important than the others. We've talked a little bit about the difference between a primary and a secondary cancer. Lung, bone, and kidney cancer do not need to be primary cancers in order to qualify for compensation under the Special Exposure Cohort. So while under the dose reconstruction process, the concern is with primary cancers, even a secondary lung cancer, bone cancer, or kidney cancer will give rise to payment under the Special Exposure Cohort process. So it's not unusual for there to be a prostate cancer that metastasizes, spreads to the bone, and you'll have a secondary bone cancer. The secondary bone cancer is paid under the SEC. So that's an important point. The fourth cancer is leukemia. It needs to be diagnosed at least 2 years after first exposure. So the leukemia needs to be diagnosed at least 2 years after the worker started working at one of the Special Exposure Cohort facilities. Also, chronic lymphocytic leukemia is another cancer that is not included under the Special Exposure Cohort designated, 22 designated cancers. There is a story behind that. It's our understanding that chronic lymphocytic leukemia is not prevalent among the inhabitants of Hiroshima and Nagasaki, and that the latency period is quite significant, and therefore it was this cancer was not captured in the studies that determine the probability of causation, the calculation that they use in the statistical model for the dose reconstruction process. So chronic lymphocytic leukemia was initially excluded from the list of 22 cancers. In fact, it was characterized as a non-radiogenic cancer and there wasn't even a dose reconstruction performed. That rule has been changed. Chronic lymphocytic leukemia is now considered radiogenic, but it has not been added to the list of 22 cancers. There are a number of cancers that need to be primary cancers in order to be considered one of the 22 designated cancers. And they also have to be diagnosed at least 5 years after the first exposure at a facility. And those include bile duct cancer, brain cancer, breast cancer, both male and female, colon cancer, cancer of the esophagus, cancer of the gallbladder, cancer of the liver cancer, but only if there is no history of cirrhosis or hepatitis B. So there again, if there's cirrhosis or hepatitis B, that claim goes through the dose reconstruction process. And so a partial dose reconstruction will be prepared to manage, to determine whether that cancer was caused by radiation. Ovary cancer, pancreatic cancer, cancer of the pharynx. Now this is important because there are various head and neck cancers, and from time to time it won't be clear whether the cancer can be fairly characterized as a pharynx cancer or some other type of head and neck cancer. Cancer of the salivary gland, cancer of the small intestine, cancer of the stomach, cancer of the thyroid, and cancer of the urinary bladder.